Hey, Unicorn Nurse here, and I have a special presentation for nursing students and those who are going to be taking the nclex soon. This is a 50 question nclex style question presentation. We have questions, answers, and rationales. So let's get started. Number 1. A patient with acute respiratory distress syndrome is on a ventilator. Which protocols should the nurse follow to prevent ventilator-associated pneumonia? Select all that apply. A. Maintain hygiene and oral care daily. B. Elevate the head of the bed to 55 degrees. C. Conduct a readiness assessment to extubate. D. Prevent venous thromboembolism. And E. Maintain a break from sedation on alternate days. Our answers are prevent venous thromboembolism, maintain hygiene and oral care daily, and conduct a readiness assessment to extubate. Our rationale for this is the nurse should take preventative measures to reduce the risk of venous thromboembolism in patients hospitalized for critical illnesses like acute respiratory distress syndrome. When in contact with the patient, oral care and hygiene should be maintained with chlorhexidine solution. The nurse should conduct a readiness test to determine if the patient is set for extubation on a daily basis. As per the components of the ventilator care bundle, the head of the bed should be elevated 30 to 45 degrees, and the nurse should stop the sedation at a daily interval so that the patient can take a break from being unconscious. Number 2. A female nurse who sometimes tries to save time by putting medications in her uniform pocket to deliver to clients confides that after arriving home, she found a hydrocodone Vicodin tablet in her pocket. Which possible outcome of this situation should be the nurse's greatest concern? A. Accused of diversion. B. Reported for stealing. C. Reported for a HIPAA violation. And D. Accused of unprofessional conduct. Our answer is accused of diversion. Even this is the only one incident the nurse may be suspected of taking medications on a regular basis, and the incident could be interpreted as diversion or diverting narcotics for her own use, which should be reported to the peer review committee and to the State Board of Nursing. B, C, and D are also of concern, but A is the most serious possible outcome. Number 3. A nurse in the ICU is planning the care of a patient who is being treated for shock. Which of the following statements best describes the pathophysiology of this patient's health problem? A. Blood is being shunted from vital organs to peripheral areas in the body. B. Cells lack an adequate blood supply and are being deprived of oxygen and nutrients. C. Circulating blood volume is decreased with a resulting change in the osmotic pressure gradient. Or D. Hemorrhage occurs as a result of trauma, depriving vital organs of adequate perfusion. Our answer is cells lack an adequate blood supply and are deprived of oxygen and nutrients. Shock is a life-threatening condition with a variety of underlying issues and causes. Shock is caused when the cells have a lack of adequate blood supply and are being deprived of oxygen and nutrients. In cases of shock, blood is shunted from peripheral areas of the body to the vital organs. Hemorrhage and decreased blood volume are associated with some, but not all types of shock. Number 4. The patient with severe urinary tract infection has a prescription for cefepime 2-gram IV Q6 hours. The vial in the patient's medication drawer has been reconstituted and is labeled as having a concentration of 200 milligrams per milliliter. How many milliliters of solution should be added to the IV bag? A. 2 milliliters. B. 5 milliliters. C. 10 milliliters. Or D. 15 milliliters. This is where our dimensional analysis comes in. 10 milliliters. So we're going to do our math. 2 grams is equal to 2,000 milligrams. So we've got to do our conversions here. And proportion, multiply 200 by x, multiply by 2,000 times 1 to yield 200x equals 2,000. Divide 2,000 by 200 to yield 10 milliliters. Number 5. Which client should the nurse identify as being at highest risk for complications during the use of opioid analgesic? A. The older client with type 2 diabetes mellitus. B. A client with chronic rheumatoid arthritis. C. A client with an open compound fracture. Or D. A young adult with inflammatory bowel disease. The answer is the young adult with inflammatory bowel disease. The principal indication for opioid use is for acute pain, and the client with the inflammatory bowel disease is at risk for toxic megacolon or periatic ileus related to slow peristalsis as a side effect of morphine. Adverse effects of morphine do not pose as great of a risk for clients with diabetes or fracture as for the client with the bowel disease. Number 6. The nurse is assessing a client with a diagnosis of pre-renal acute injury, or AKI. Which condition would the nurse expect to find in the client's recent history? A. Pyelonephritis. B. Myocardial infarction. C. Bladder cancer. Or D. Kidney stones. The answer is myocardial infarction. Pre-renal causes of AKI are related to a decrease in perfusion, such as with myocardial infarction. Pyelonephritis is an intrinsic or intrarenal cause of AKI related to kidney damage. Bladder cancer and kidney stones are post-renal causes of AKI related to urine flow obstruction. Number 7. The nurse is assessing an 8-month-old child who has a medical diagnosis of tetralogy flow. Which symptom is the client most likely to exhibit? A. Bradycardia. B. Machinery murmur. C. Weak pedal pulses. Or D. Clubbed fingers. Our answer is going to be clubbed fingers. Tetralogy flow, a cyanotic heart defect, causes clubbing of fingers and toes due to tissue hypoxia. Tachycardia, not A, is a manifestation of congenital heart disease. B is a classic sign of ventricular septal defect, and C is a characteristic of a coarctation of the aorta. Number 8. An 8-year-old boy who is recently diagnosed with diabetes mellitus is admitted to the intensive care unit with diabetic ketoacidosis, or DKA. Which nursing action has the highest priority? A. Place on a cardiac monitor. B. Initiate an intravenous infusion. C. Collect specimen for serum electrolytes. Or D. Obtain fingerstick glucose. The answer is initiate an intravenous infusion. The priority for a child with DKA, an emergency life-threatening situation, is to obtain venous access for the administration of fluids, electrolytes, and insulin. The child should be placed on a cardiac monitor and have serum electrolytes and glucose levels obtained, but not before initiating venous access. So we need to have access in order to do all of these things. So access first. Number 9. Which technique is most important therapeutic tool a nurse should use to provide quality of care to a psychiatric client? A. Context. B. Self-analysis. C. Countertransference. Or D. Therapeutic self-disclosure. Self-analysis. Self-analysis is a tool for the nurse to examine oneself, view one's responses in various mental and emotional moments, and provide a sense of how sensitive care should be provided related to one's own needs. The nurse's primary tool is self-analysis and use the therapeutic self to establish therapeutic empathy and achieve authentic, open, and personal communication with the client. The other techniques may occur in the nurse-client relationship, but do not contribute to establishing a therapeutic relationship. Number 10. A male client comes to the emergency room department with a serum creatinine of 2.2 milligrams per deciliter and a blood urea nitrogen, or BUN, of 24 milliliters per deciliter. Which question should the nurse ask first when taking the client's history? A. Have you been taking any aspirin, ibuprofen, or naproxen lately? B. Do you have anyone in your family with renal failure? C. Have you had a diet that is low in protein recently? Or D. Has a relative had a kidney transplant lately? The answer is, have you been taking any aspirin, ibuprofen, or naproxen recently? There are some medications that are nephrotoxic, such as nonsteroidal anti-inflammatory drugs, ibuprofen, aspirin, and naproxen. This would be a good question to initially ask the client since both the serum creatinine and BUN are elevated, indicating some renal problems. A family history of renal failure and kidney transplantation would not be part of the questioning and could cause anxiety in the client. The diet high in protein could be a factor of an increased BUN. Number 11. A nurse is eating out with a friend and witnesses several people injured in a building fire at a restaurant. Considering the Good Samaritan law, which statement concerning the situation is correct? A. As a healthcare provider, the nurse must provide care at the scene. B. The nurse must report to the assigned first aid station before providing assistance. C. The nurse should care for the older aging patients after caring for the women and children. Or D. If the nurse does try to assist, he or she must not leave until the trained responders arrive. The answer is, if the nurse does try to assist, he or she must not leave until trained responders arrive. When a nurse becomes involved in any way at a scene of a disaster, he or she is obligated to stay until trained responders arrive at the scene. As an off-shift healthcare provider, the nurse is not obligated to provide care at the scene under the Good Samaritan law. It is considered gross negligence to treat victims based on age, sex, or disability. The nurse must report to an assigned first aid station when volunteering with a disaster team, but this is not part of the Good Samaritan law. Number 12. In assessing a client diagnosed with primary hyperaldosteronism, the nurse expects the laboratory test to indicate a decreased serum level of which substance? A. Sodium, B. Antidiuretic hormone, C. Potassium, or D. Glucose. The answer is potassium. Clients with primary hyperaldosteronism exhibit a profound decline in the serum levels of potassium or hypokalemia. Hypertension, along with hypokalemia, are the most prominent universal sides of the condition. If both these findings are present, there is 50% likelihood that the client will be diagnosed with hyperaldosteronism. Number 13. A child who weighs 32 pounds receives a prescription for Augmentin, 194 milligrams PO every 8 hours. The recommended dose is 40 milligrams per kilogram per day. The bottle contains 125 milligrams per 5 milliliters. How many milligrams should the child receive in a 24-hour period? A. 487 milligrams. B. 582 milligrams. C. 583 milligrams. Or D. 620 milligrams. The answer is 582 milligrams. So, like I said, we're going to be doing some more dimensional analysis in here. So we're going to go by the child's weight in kilograms. 1 pound or 1 kilogram. Sorry, I keep getting interrupted. The child's weight in kilograms, 2.2 equals 1 kilogram equals 32 pounds. X kilograms, 14.54 kilograms is used to calculate the recommended dose. 40 milligrams times 14.54 kilograms a day equals 581.81, which equals 582 milligrams. The prescribed dose in 24 hours is 194 milligrams times 3 doses, which is rounded to 582 milligrams. Number 14. A client has a serum potassium level of 6.5 mmol per liter, a serum creatinine level of 2 milligrams per deciliter, and a urine output of 350 milliliters a day. Which is the best action by the nurse? A. Place the client on a cardiac monitor immediately. B. Teach the client to limit high potassium foods. C. Continue to monitor the client's intake and output. Or D. Have the laboratory redraw the blood specimen. The answer is place the client on a cardiac monitor immediately. The priority action by the nurse should be to check the cardiac status with the monitor. High potassium levels can lead to dysrhythmias. The other choices are logical nursing interventions for acute kidney injury, but are not the best immediate action. Number 15, a client taking furosemide or Lasix 40 milligrams a day for management of chronic kidney disease or CKD. To detect the positive effect of the medication, what action of the nurse is best? A, obtain daily weights of the client. B, auscultate heart and breath sounds. C, palpate the client's abdomen. Or D, assess the client's diet history. The answer is obtain daily weights of the client. Lasix is a loop diuretic that helps reduce fluid overload and hypertension in clients in early stages of CKD. 1 kilogram of weight equals to about 1 liter of fluid retained on the client. So daily weights are necessary to monitor the response of the client to the medication. Heart and breath sounds should be assessed if there is fluid retention, as in heart failure. Palpation of the client's abdomen is not necessary, but the nurse should check for edema. The diet history of a client would be helpful to assess electrolyte replacement, since potassium is lost with this diuretic, but does not assess the effect of the medication. Number 16. Human chorionic gonadotropin is prescribed to an infertile patient. What explanation will the nurse provide when the patient asks why they will be taking this? A, to induce ovulation. B, to promote the development of follicles. C, to suppress the release of follicle-stimulating hormone. Or D, to prevent the premature releasing of luteinizing hormone. The answer is to induce ovulation. Human chorionic gonadotropin stimulates the release of eggs from the follicles and induces ovulation in patients with infertility. Gonadotropins promote the development and maturation of follicles in the ovaries. Gonadotropin releasing hormone antagonists prevent premature ovulation. Gonadotropin releasing hormone agonists like leuprolide suppress the release of luteinizing hormone and follicle-stimulating hormone in patients with infertility. Sorry, I cannot talk today, guys. I'm sorry. I tried. All right, next one. Number 17. A patient is receiving treatment for a sexually transmitted infection prior to culture resulting being obtained. Okay. The nurse is to administer ceftriaxone intramuscularly. Which sexually transmitted infection does the nurse recognize as being treated? A, gonorrhea. B, candidiasis. C, herpes simplex virus type 2. Or D, human immunodeficiency virus. The answer is gonorrhea. Treatment for gonorrhea is ceftriaxone. In addition, treatment for chlamydia, which often coexists, may be included. Candidiasis is a yeast infection that may be treated with fluconazole or amphotericin B for systemic infections, or topical azole for vaginal infections. Herpes is treated with acyclovir, Zyrovax, famciclovir or Famvir, or valacyclovir or Valtrex. Human immunodeficiency virus is managed rather than treated, and several categories of drugs are used. Number 18. A patient who underwent percutaneous transluminal angioplasty, or PTA, to treat lower leg peripheral artery disease is prescribed 75 milligrams of aspirin daily. What is the desired effect of the medication? A, to prevent platelet aggregation, stimulate collateral circulation, decrease liver production of vitamin K, and control pain resulting from the procedure. We're going to prevent platelet aggregation. Aspirin is prescribed for its antiplatelet effect. It interferes with platelet aggregation sticking together to form a blood clot. Exercise is a means to improve colloidal circulation. Warfarin Coumadin is an anticoagulant that blocks vitamin K production by the liver. and a single daily dose of 75 milligrams of aspirin is insufficient for pain relief. Number 19. An older client who requires frequent monitoring fell and fractured a hip. Which nurse is at greatest risk for a malpractice judgment? A. The nurse who worked the 7 to 3 shift at the hospital who wrote poor nursing notes. B. The nurse assigned to care for the client who was at lunch at the time of the fall. C. The nurse who transferred the client to the chair when the fall occurred. Or D. The charge nurse who completed rounds 30 minutes before the fall occurred. The answer is the nurse who transferred the client from the chair when the fall occurred. The 4 elements of malpractice are breach of duty owed, failure to adhere to the recognized standard of care, direct causation of injury, and evidence of actual injury. The hip fracture is the actual injury, and the standard of care was frequent monitoring. The nurse most at risk for malpractice is the one which duty was owed, transferring the client safely, and the injury occurred while the nurse was in charge of the client's care. Number 20. A patient who is receiving IV antibiotics develops wheezes and dyspnea. In which order should the nurse implement these prescribed actions? A. Discontinue the antibiotic. B. Give diphenhydramine or Benadryl IV. C. Inject epinephrine, IM or IV. D. Prepare an infusion of dopamine. Or E. Provide 100% oxygen using a non-rebreather mask. So this is one of those nclex questions where it asks you to place things in order. So we're going to go in the order of A, E, C, B, D. We're going to discontinue the antibiotic. Then we're going to give 100% oxygen using a non-rebreather mask. Then we're going to give IV or IM epinephrine, and then give IV Benadryl, and then we will prepare an infusion of dopamine. The nurse should initially discontinue the antibiotic because it's the likely cause of the allergic reaction. The oxygen delivery should be maximized, followed by treatment of bronchoconstriction with epinephrine administered IV or IM. Diphenhydramine will work more slowly than epinephrine, but will help prevent progression of the reaction. Because the patient currently does not have evidence of hypotension, the dopamine infusion can be prepared last. Number 21. A patient who has a positive test for HIV antibodies is admitted to the hospital with pneumocystitis jirovecii pneumonia, or PCP, and a CD4 plus T cell count of less than 200 cells per milliliter. Based on the diagnostic criteria established by the CDC, which statement by the nurse is correct? A. The patient will develop symptomatic HIV within a year. B. The patient treats the criteria for diagnosis of acute HIV infection. C. The patient will be diagnosed with asymptomatic chronic HIV infection. Or D. The patient has developed acquired immunodeficiency syndrome or AIDS. The answer is the patient has developed acquired immunodeficiency syndrome or AIDS. Development of PCP meets the diagnostic criteria for AIDS. Though the responses indicate earlier signs of HIV infection, then this is indicated by the PCP infection. Number 22. A healthcare provider prescribes ceftriaxone or Dura for a client with a postoperative infection. It is the most important for the nurse to assess for what additional drug allergy before administering this prescription. A. Penicillins. B. Aminoglycosides. C. Erythromycins. Or D. Sulfonamides. The answer is penicillins. Cross allergies exist between penicillins and cephalosporins, such as ceftriaxone or Duracef. So checking for penicillin allergy is a wise precaution before administering this drug. Number 23. A patient with a non-surgical wound visits the wound care center. The nurse notes that the wound is pink and vascular with numerous red granules. In what stage of healing is this wound? A. Initial phase. B. Granulation phase. C. Maturation phase. Or D. Scar contraction. The answer is granulation phase. The wound is in the granulation phase of primary intention healing. Primary intention healing takes place when wound margins are neatly approximated and is not a surgical incision. In the initial 3 to 5 days, fibrin clot serves to mesh work for the future capillary growth and mitigation of epithelial cells. Scar contraction occurs during the maturation phase. In contrast to granulation tissue, a mature scar is virtually avascular and pale. The scar may be more painful at this phase than in the granulation phase. Number 24. A patient with a spinal cord injury has a neurogenic bowel. Beyond the use of biscotal suppositories and digital stimulation, which measures should the nurse teach the patient and the caregiver about how to assist the patient with bowel evacuation? Select all that apply. A. Drink more milk. B. Use oral laxatives every day. C. Eat 20 to 30 grams of fiber per day. D. Drink 1,800 to 2,800 milliliters of water or juice. And E. Establish bowel evacuation time at bedtime. Your answers are going to be eat 20 to 30 grams of fiber a day and to drink 1,800 to 28 milliliters of water or juice. The patient with a spinal cord injury and neurogenic bowel should eat 20 to 30 grams of fiber and drink 1,800 to 2,800 milliliters of water or juice each day. Milk may cause constipation. Daily oral laxatives may cause diarrhea and are avoided unless necessary. Bowel evacuation time usually is established 30 minutes before the first meal of the day to take advantage of the gastrocolic reflex induced by eating. Number 25. The nurse is assessing a 2-year-old. What behavior indicates that the child's language development is within normal limits? A. Is able to name 4 colors. B. Can count 5 blocks. C. Is capable of making 3-word sentences. Or D. Half of the child's speech is understandable. The answer is half of the child's speech is understandable. Between approximately 15 to 24 months of age, a child's speech is only half understandable. A child can begin counting and name some colors usually between 3 and 5 years of age. A child is capable of 2 to 4 word sentences between 18 months and 24 months of age. Number 26. Which pediatric client requires immediate intervention by the nurse? A. A 2-year-old with a 24-hour urinary output of 500 milliliters. B. A 3-year-old with several episodes of nocturnal enuresis. C. A 4-year-old with an easily palpable bladder and frequency. Or D. A 5-year-old with diuresis following Lasix administration. The answer is a 4-year-old with an easily palpable bladder and frequency. Frequency and bladder distension are indications of urinary retention, which require immediate intervention by the nurse. The other options do not indicate any need for immediate intervention. Number 27. It is important for the nurse providing care to a patient with sickle cell crisis to A. Limit the patient's intake of oral and IV fluids. B. Evaluate the effectiveness of opioid analgesics. C. Encourage the patient to ambulate as much as tolerated. Or D. Teach the patient about high protein, high calorie foods. The answer is to evaluate the effectiveness of opioid analgesics. Pain is the most common clinical manifestation of a crisis and usually requires large doses of continuous opioids for control. Fluid intake should be increased to reduce blood viscosity and improve perfusion. Rest is usually ordered to decrease metabolic requirements. Patients are instructed about the need for dietary folic acid, but high protein, high calorie diets are not emphasized. Number 28. A patient underwent a testicular examination. Which finding would the nurse expect to be a cause of concern? A. Absence of foreskin. B. Undescended testes. C. Lower testes lower than right testes. Or D. Coarse pubic hair in a diamond-shaped pattern. Answer is undescended testes. An undescended testes is a cause of concern as it is a major risk factor for testicular cancer and a potential cause of male infertility. Normal findings include absence of foreskin, left testes lower than right testes, and presence of coarse pubic hair in a diamond-shaped pattern. Number 29. Which patient would benefit from a lung transplant? A. a patient with poor nutritional status. B, a patient with chronic active hepatitis B. C, a patient with alpha-1 antitrypsin deficiency. Or D, a patient with human immunovirus infection. The answer is a patient with alpha-1 antitrypsin deficiency. A patient with alpha-1 antitrypsin deficiency has an inability to restore the lung elasticity. Therefore, the lung transplantation is indicated for this patient. Lung transplantation involves immunosuppressant treatment, which may not be tolerated with patients with poor nutritional status, chronic active hepatitis B, and human immunovirus infection. Number 30. The nurse observes a return demonstration by a patient who is learning how to mix regular insulin and NPH insulin in the same syringe. Which action by the patient indicates the need for further teaching? A, withdrawing the NPH insulin first. B, injecting air into the NPH bottle first. C, removing air bubbles after drawing up the first insulin. Or D, injecting an equal amount of air to the desired dose of insulin. The answer is withdrawing the NPH insulin first. Regular insulin is always withdrawn first, so it is not to become contaminated with the NPH insulin. Injecting air into the NPH bottle first, removing air bubbles after drawing up the regular insulin, and injecting air equal to the desired dose of insulin are correct actions in regard to the mixture of the regular and NPH insulin. So regular insulin is always first. Number 31. An appropriate nursing intervention for a patient with non-Hodgkin's lymphoma whose platelet count drops to 18,000 during chemotherapy is to check all stools for occult blood. B, encourage fluids to 3,000 milliliters a day. C, provide oral hygiene every 2 hours. Or D, check the temperature every 4 hours. The answer is to check all stools for occult blood. Because the patient is at risk for spontaneous bleeding, the nurse should check stools for occult blood. A low platelet count does not require an increased fluid intake. Oral hygiene is important, but is not necessary to provide oral care every 2 hours. The low platelet count does not increase risk for infection, so frequent temperature monitoring is not indicated. Number 32. A client admitted to the hospital with medical diagnosis of pneumococcal pneumonia. The nurse knows that the prognosis for gram-negative pneumonia such as E. coli, Klebsiella, or Pseudomonas and Proteus is very poor because A, they occur in the lower lobe alveoli, which are more sensitive to infection. B, gram-negative organisms are more resistant to antibiotic therapy. C, they occur in healthy young adults who have recently been debilitated by an upper respiratory infection. Or D, gram-negative pneumonias usually affect infants and small children. The answer is gram-negative organisms are more resistant to antibiotic therapy. The gram-negative organisms are very resistant to drug therapy, which makes recovery very difficult and has become a worldwide concern in which the World Health Organization is keeping a very close surveillance on these occurrences. Number 33. A patient has ptosis resulting from myasthenia gravis. Which assessment finding would the nurse expect to see in this patient? A, redness and swelling of the conjunctiva. I'm telling y'all, I can't talk today. I'm so sorry. B, drooping of the upper eyelid margin in one or both eyes. C, redness, swelling, and crusting along the eyelid margin. Or D, small superficial white nodules along the lid margin. The answer is drooping of the upper lid margin in one or both eyes. Ptosis is a term used to describe drooping of the upper lid margin, which may be either unilateral or bilateral. Ptosis can be a result of mechanical causes such as an eyelid tumor or excess skin, or from myogenic causes such as myasthenia gravis. Ptosis is not related to redness and swelling of the conjunctiva or lid margin or small superficial white nodules along the lid margin. Number 34. The nurse would be correct in withholding a dose of digoxin in a client with congestive heart failure without specific instruction from the healthcare provider if the client's A, serum digoxin level is 1.5, B, blood pressure is 104/68. C, serum potassium level is 3. Or D, apical pulse is 68 beats per minute. The answer is serum potassium level is 3. Hypokalemia can precipitate digitalis toxicity in persons receiving digoxin, which will increase the chance of dangerous dysrhythmias. And the normal potassium level is 3.5 to 5.5 milliequivalents per liter. Number 35. The nurse notices clear nasal drainage from a patient newly admitted with facial trauma, including a nasal fracture. What should the nurse do first? A, test the drainage for the presence of glucose. B, suction the nose to maintain airway clearance. C, document the finding and continue monitoring. Or D, apply a drip pad and reassure the patient that this is normal. The answer is test the drainage for the presence of glucose. Clear nasal drainage suggests leakage of cerebrospinal fluid, or CFF. The drainage should be tested for the presence of glucose, which would indicate the presence of CSF. Suctioning should not be done. Documenting the findings and monitoring are very important after notifying the healthcare provider. A drip pad may be applied, but the patient should not be reassured that this is normal because this is not normal. Number 36. A patient with pheochromocytoma is prescribed propranolol during preoperative care. Say that 5 times fast. Which instruction provided by the nurse is most appropriate to prevent complications in this patient? A, obtain adequate rest. B, make postural changes cautiously. C, have a blood pressure check frequently. Or D, consult your primary healthcare provider if you have severe headache. The answer is make postural changes cautiously. Propranolol is a B-adrenergic receptor blocker that is administered during preoperative care to treat tachycardia, dysrhythmias, and high blood pressure in order to prevent intraoperative hypertensive crisis. Propranolol causes orthostatic hypotension, so postural changes should be made cautiously to prevent falls. Adequate rest should be taken by the patient, but is not related to preventing falls. Blood pressure should be monitored regularly to prevent hypertensive crisis. A severe headache should be reported to the primary healthcare provider for immediate intervention. However, this condition is unconnected to complications of propranolol. Number 37. The nurse is performing an assessment of the accessory nerve. What should the nurse ask the patient to do? A, assess the gag reflex by stroking the posterior pharynx. B, ask the patient to shrug the shoulders against resistance. C, ask the patient to push their tongue to either side against resistance. Or D, have the patient say ah while visualizing evaluation of the soft palate. The answer is ask the patient to shrug the shoulders against resistance. The spinal accessory nerve is tested by asking the patient to shrug the shoulders against resistance and to turn the head to either side against resistance while observing the sternocleidomastoid muscles and the trapezius muscles. Assessing the gag reflex and saying ah are used to assess the glossopharyngeal and vagus nerves. Asking the patient to push their tongue to either side against resistance and to stick out their tongue are used to assess the hypoglossal nerve. Number 38. A female client with rheumatoid arthritis takes ibuprofen 600 milligrams 4 times a day to prevent gastrointestinal bleeding. Cytotec 100 micrograms PO is prescribed. Which information is important for the nurse to include in teaching? A, use contraception during intercourse. B, ensure the Cytotec is taken on an empty stomach. C, encourage oral fluid intake to prevent constipation. Or D, take Cytotec 30 minutes prior to Motrin. The answer is use contraception during intercourse. Cytotec is a synthetic form of prostaglandin, classified as a pregnancy category X and can be acted as an abortifacient. So it can cause abortion. So the client should be instructed to use contraception during pregnancy to prevent pregnancy loss of an early pregnancy. A common side effect of Cytotec is diarrhea, so constipation prevention strategies are usually not needed. Cytotec and Motrin should be taken together, not 30 minutes apart, and to prevent it's to provide protective properties against the gastrointestinal bleeding. from taking Motrin 4 times a day. Number 39, in evaluating the effects of lactulose, which outcome would indicate that the drug is performing as intended? A, an increase in urinary output. B, 2 or 3 soft stools per day. C, watery diarrhea stools. Or D, increased serum bilirubin. The answer is 2 to 3 soft stools per day. Lactulose is administered to reduce blood ammonia by excretion of an ammonia through the stool. 2 or 3 soft stools a day indicate the lactulose is performing as intended. A would be expected if the patient was receiving a diuretic, and C would indicate an overdose of the lactulose and is not expected. Lactulose does not affect D. Number 40, which problem reported by a patient with hemophilia is most important for the nurse to communicate with the healthcare provider? A, leg bruises. B, tarry stools. C, skin abrasions. Or D, bleeding gums. The answer is tarry stools. Melena is a sign of gastrointestinal bleeding and requires collaborative actions such as checking hemoglobin and hematocrit and administration of coagulation factors. The other problems indicate a need for patient teaching about how to avoid injury but are not indicators of possible serious blood loss. Number 41. A patient is scheduled to receive a transfusion of 2 units of packed red blood cells, or PRBCs. The nurse would ask which healthcare team member to assist in checking the unit before administration. A, the unit secretary. B, the physician's assistant. C, another registered nurse. Or D, the unlicensed assistive personnel. Answer is going to be another registered nurse. Before handing a transfusion, the registered nurse must check the unit with another registered nurse or a licensed practical nurse or a vocational nurse, but they have to be a nurse, depending on agency policy. If there's not another nurse available, a healthcare provider could check the blood with the nurse. The unit secretary and UAP are not licensed to perform this duty. Very important. They do not have the license to perform this duty. Number 42. A client with congestive heart failure, CHF, is being discharged with a new prescription for an angiotensin converting enzyme, or ACE inhibitor, captopril. The nurse's discharge instructions should include reporting which problem to the healthcare provider. A, weight loss. B, dizziness. C, muscle cramps. Or D, dry mucous membranes. The answer is going to be D's, dizziness. Angiotensin converting enzyme, or ACE inhibitors, are used in CHF to reduce overload by reversing vasoconstriction common in heart failure. This vasodilation can cause hypotension and result dizziness. A is desired if fluid overload is present and may occur as the result of effective combination drug therapy such as diuretics with ACE inhibitors. C often indicates hypokalemia in the client receiving diuretics. Excessive diuretic administration may result in fluid volume deficit, manifested by symptoms such as D. Number 43. To ensure patient safety and reduce risk associated with surgical procedures, the circulating nurse calls a surgical timeout prior to surgery. Which activities should be included in the timeout? Select all that apply. A, verify patient identification. B, complete a fire risk assessment. C, verify surgical site and procedure. D, ensure that the consent for the specific procedure was obtained. And E, ensure that a significant other is available if needed for consultation. The answers are going to be verify patient identification, complete a fire risk assessment, verify surgical site and procedure, and ensure that the consent for the specific procedure was obtained. So just before a surgical procedure, all surgical team members complete a surgical timeout to prevent risk of fire, wrong patient, wrong site, wrong procedure. The team must also ensure that consent was obtained. Although a significant other may be present for consultation if needed, this action is not an aspect of the surgical timeout process. Number 44. The nurse is preparing to disconnect IV tubing from the access port so that the patient can ambulate to the bathroom. What will the nurse wear to prevent spread of pathogens? A cap. B, gloves. C, shoe covers. Or D, an isolation gown. The answer is going to be gloves. When disconnecting IV tubing, the nurse may come in contact with blood. Therefore, personal protective equipment such as gloves should be used. This also helps the nurse avoid an infection by not touching contaminated items or surfaces. Caps, gowns, and boots are not required when removing IV tubing. So, if you're dealing with IV tubing, please always wear your gloves. Another thing on a side note, when you disconnect your IV tubing and you reconnect your IV tubing, please clean it with alcohol. For the love, please clean it, because we do not want to introduce an infection in these patients. Use your little alcohol swabs. They're there for a reason. Number 45. A resident of a long-term facility is taking lithium carbonate to treat bipolar disorder. Which instruction should the nurse provide to this client's caregivers? A. Offer the morning dose of the medication before breakfast. B. Have the client chew the pill as it is difficult to swallow. C. Encourage high energy fluid intake by providing sports drinks or sodas. Okay. D. Report symptoms of hypothyroidism such as fatigue and constipation. We're going to report symptoms of hypothyroidism such as fatigue and constipation. Lithium carbonate causes hypothyroidism in 1 to 4% of the clients receiving this medication. So caregivers should assess for signs of hypothyroidism, including fatigue and constipation, which are early signs, or myxedema or goiter, which are late symptoms. Number 46. The nurse plans a presentation for community members about how to decrease the risk of antibiotic resistance infections. Which information will the nurse include in the teaching plan? Select all that apply. A. Antibiotics may sometimes be prescribed to prevent infection. B. Continue taking antibiotics until all of the prescription is gone. C. Unused antibiotics that are more than a year old should be discarded. D. Antibiotics are effective in treating influenza associated with high fevers. And E. Hand washing is effective in preventing many viral and bacterial infections. The answer is antibiotics may sometimes be prescribed to prevent infection. Continue taking antibiotics until all of the prescription is gone, and hand washing is effective in preventing many viral and bacterial infections. So rationale for this is all prescribed doses of antibiotics should be taken. In some situations, such as before surgery, antibiotics are prescribed to prevent infection. There should not be any leftover antibiotics because all prescribed doses should be taken. However, if there are leftover antibiotics, they should be discarded immediately because the number left will not be enough to treat a future infection. Hand washing is generally considered the single most effective action in decreasing infection transmission, and antibiotics are ineffective in treating viral infections such as influenza. So do not use antibiotics for a viral infection, and wash your hands and take all of your antibiotics. Number 47. Which menu choice indicates that the patient understands the nurse's teaching about recommended dietary choices for iron deficiency anemia? A. Omelet and whole wheat toast. B. Cantaloupe and cottage cheese. C. Strawberry and banana fruit plate. D. Cornmeal muffin and orange juice. The answer is omelet with whole wheat toast. Eggs and whole grain breads are high in iron. The other choices are appropriate for other nutritional deficiencies, but are not the best choice for a patient with iron deficiency anemia. Number 48. Which instruction should the nurse is beneficial to a female patient to prevent recurrent urinary tract infection? A. Restrict prunes from your diet. B. Wipe back to front after urinating. C. Schedule a follow-up urine culture. Or D. Empty your bladder before and after sexual intercourse. The answer is empty your bladder before and after sexual intercourse. The patient should empty the bladder before and after sexual intercourse to prevent recurrent urinary tract infections. Restricting dietary purines is important for reducing the risk of renal calculi formation. A patient with an acute pyelonephritis should have a follow-up urine culture, and female patients should wipe front to back to avoid contamination with E. coli. Always wipe front to back. Number 49. An older client is taking warfarin, PO 2.5 milligrams twice a day. Which laboratory value should the nurse identify as a therapeutic response to this medication? A. An INR of 2 to 3. B. A PT of 4 seconds. C. A PTT of 20 seconds. Or D. A PTT of 3 times normal. The answer is an INR of 2 to 3. Recommended INR ranges for clients on warfarin therapy is 2 to 3. Therapeutic anticoagulation using Coumadin should prolong the prothrombin time, or PT, by 1.5 to 2 times the control value. A normal value is 10 to 20 seconds, or 20 to 30% of normal value if percentages are used. Number 50. Which complication of diabetes can be treated with hyperbaric oxygen? A. Diabetic foot ulcers. B. Diabetic neuropathy. C. Neuropathic arthropathy. Or D. Peripheral vascular disease. The answer is diabetic foot ulcers. Hyperbaric oxygen is used for wound healing in diabetic foot ulcers. Angiotensin converting enzyme inhibitors and angiotensin receptor blockers are used in the treatment of diabetic neuropathy. Neuropathic arthropathy results in ankle and foot changes and increases the chances of developing foot ulcers. Peripheral vascular disease is one of the macrovascular complications of diabetes, and management includes smoking cessation and control of hypertension. Alright, that's all I have for you guys today. Thank you for watching this presentation, and I hope that these 50 nclex questions help. If you like this video, please like and subscribe for more content. You can also follow me on TikTok at unicornnurse20. So, have a great day and happy nursing!